Prince Miller Entertainment TV. Today is the 29th of August 2022. Remember guys to like, share, comment and follow, and turn on the notification bell so that you won't miss any of our new uploads that we do upload here. And so guys, here's the latest. Doctors Without Borders, DWB, is decried an ongoing xenophobic protest outside KALAFONG Provincial Tertiary Hospital, stopping patients, especially migrants, receiving healthcare services. The organization said the actions must be rejected and should trigger urgent action by health authorities and leaders to protect access to health care for all. Operation Dudula supporters have been protesting outside the hospital in Atteridgeville, Tshwane, for 3 weeks, chanting threatening statements through loud yells and preventing many from entering the facility, said the organization. On Friday, several people were turned away by the protesters based on their appearance and accent, says Busiso Ndlovu, health promotion supervisor for the organization in Tshwane, adding that the protesters are putting hospital staff under immense pressure with demands that all foreigners be removed. Hostility to serving migrants in SA's health facilities has been intensifying, fueled by inflammatory and political statements from government officials, including the Popo Health MEC Dr. Poppy Ramathuba, who was recently recorded berating a Zimbabwean patient in a health facility, claiming migrants are overburdening the health system, said Doctors Without Borders. If migrants are fearful for their safety when entering or leaving health facilities, and if health workers are placed under pressure to behave as immigration officers, the consequences will be felt across the population, said the organization. One major concern as the politicization of healthcare expands is that serious, not fatal diseases could go unrecorded and untreated, which will inhibit the public healthcare system overall capacity and ability to contain infectious disease outbreaks, says Dr. Atasanya Chishana, medical activity manager for Doctors Without Borders in Tshwane. One patient denied care in KALAFONG Hospital was a 37-week pregnant migrant woman with high blood pressure, who instead had to seek help at a local clinic, said Doctors Without Borders. Clinics are not equipped to provide tertiary care for complex cases such as these, which requires access to a specialist and certain medications that are only available at hospital level, Chisamane said. And so guys, that's the latest here. Those tutakuona zvichiitika whereby as a foreigner using a public health system atoma one because in some areas, of course, untona vanhu vachoti muforeigner and saka mutonemekuti things are now changing very very quick and in South Africa when it comes to the healthcare. And that video yakaitwa na MEC yokulimpopo here ndo yachita kuti vanhu vakawanda vazive kutoti zvikutoitika izvi, because pane vamwe vanhu vasiri aware of this, but they are now aware of it because of that video which was circulating, which was trending for the last few days. And so ngatitaure in the comment section. This is our daily news, breaking news, everyday news on Prince Miller Entertainment TV. Remember kuti this is affecting most of our sisters, our brothers who are in South Africa. Yes, mukadzi ane pamuviri asina permit ada kurapwa mu local hospital, public hospital facility, afana kunge atone mari pamberi, and otherwise you won't be treated. And saka mutonemekuti kuti this is one of the most difficult moments. Manje tenda kunzonzi kuzvikoro kusudwa vana vemaforeigners vasina vasina proper documents, and the next thing unonga kunzonzi dzimba musarentese vanhu vasina proper documents on your backyards. Saka mutonemekuti kuti things are changing very quick. Someone saying kuti the solution to these migrants should pay for the service. We are being taxed and foreigners are enjoying the benefits, and as migrants should pay for their services. The solution is for government to urgently wake up and do something about it. It's non-existent approach or managing the influx of people and to monitor and address those who are already here. Things will never be the same. People are tired. It was going to be like this because government has allowed lawlessness where illegal immigrants undermine South Africans. Private hospitals should take immigrants and build the government. I salute those protesters. South African government is to blame for all this, because it does not take this matter of illegal immigrants seriously. And South Africans are fed up with the slow services delivery. They take their frustrations to illegal immigrants. The issue of illegal immigrants won't affect rich people who are in suburbs or in private hospitals. Until you come across and experience the situation, then you understand why most South Africans are fed up with certain foreigners. And government officials used to say the people must work hand in hand with the government. That is what the people are doing now. And my heart is too in pain in every situation. It is the poorest of the poor who are at the receiving end. Their masters fly overseas for medical attention, and they are left to skip borders to seek medical attention, only to found this is so sad. When the Limpopo MEC complained about this problem at our health facilities, you wanted to queue here. Now people who are directly affected by this problem will address it their way, and it might not be nice. South Africans' resources cannot cater for the whole African continent. And so guys, someone said, Doctors Without Borders, this matter is simple. As medical practitioners yourselves, why don't you open hospitals and clinics to treat these undocumented immigrants? It's clear that South African citizens are tired of waiting for hours in long queues caused by non-beneficiaries of the state care. Open hospitals and clinics, simple. And so guys, this is daily news, breaking news, everyday news on Prince Miller Entertainment TV. It seems like doors are closing in for foreign nationals who are living and working in South Africa, especially us as Zimbabweans, whereby we are now seeking treatment in South Africa. And their public hospitals are better than most of our public hospitals here in Zimbabwe. So many people are now traveling to Joburg to seek a medical health care, because unotenga ka ticket rebus 450 rand watomu Joburg mangwana okutorabwa eksura mangwana okutodzoka ku Zimbabwe. And so it's a bit cheaper than going to Paranyat, whereby you be told kuti tenga chakati, tenga mabandage, tenga mshonga, and on top of that you have to pay the hospital some bills also after watenga mshonga yako yoyo. Saka motemeko toti wanawanda, they're now choosing to come to South Africa to seek medical health care, whereby public health care is free for the locals, and it's too free in some hospitals for the foreigners also. And regardless go to permit and on a permit. And so got it all in the comment section. This is a daily news, breaking news, everyday news on Prince Miller Entertainment TV. This is so sad. It's really, really sad. And I haven't heard anything from the Zimbabwean government yet regarding to that video of MEC Limpopo, or even the current situation. You could talk about social media, they haven't even replied or say anything or even a statement regarding to it. So we hope especially the Minister of Health, Constantino Chiwenga, who I personally think that he's the worst ever health minister we ever had here in Zimbabwe. And so guys, we're gonna keep you in the loop packet any new information, but the situation is getting tough, and every day news regarding to this, and it's not a good look, especially for us as Zimbabweans, whereby sometimes we can't afford to go to private hospitals in South Africa. Saka don't go upon public hospitals, yeah, but and so got it all in the comment section. Remember to like, share, comment and follow. Bless up.